See, it's preparing the live stream. And I should be able to see us when we come on here, so that way I know that we are live. Come on. And it says that we are live. Let me cut the volume down. There we go. Hey, y'all, it's me, Crystal Feliciano, Peterson's Breaking News in Trenton. We are here chopping it up, y'all. Chopping it up with the councilwoman and with the mayor. Mayor Reed Gusciora is in the house. Hey, Mayor, how you doing?
Hey, how you doing, Councilwoman?
I'm good,
Doing very
thank
well
you.
today for Monday.
I know. Here we are on a Monday. Listen, today we have a very special community guest joining us, Dr. Tashanna Ellis. Hey, Tashanna.
Hey.
So we are so excited to have you here with us today.
Thank
As
you,
we
guys.
said when we started this thing, that we were going to have it where there would be moments where the mayor and I would be having conversations about things, but we feel that it's important to bring in the community as well, to be able to have conversations and dialogue so we could let people see that, you know what, it is authentic, it is real, it is about Trenton, it is about the people, and it is about solutions. So that being said, go ahead, Mayor, I'm gonna hit it over to you.
Well, we had a productive week last week. We initiated our concept called CityStat. It originated in Atlantic City, at least in the state. And we work with DCA, who is our monitor. But when you go to a council meeting, council members individually have access to each one of our directors. This is the same concept, but allowing community residents to have direct access to our directors. And a lot of times in any kind of form of government is not perfect. Things get overlooked, things get put down in the bottom of the pile when something else comes up. This is an opportunity for residents to strictly come in and talk to the directors, ask them questions, but to bring up topics that they may have brought to their attention, and for whatever reason it fell by the wayside. So by the rules of CityStat, they have to be addressed, not completely or not finalized, but have to be addressed within 48 hours. And we are providing a communication pipeline to the person who brought that up. But this is a good way for residents to really work one-on-one with our directors and have a greater appreciation for our 10 departments. People think of just City Hall as one big building, but yet it's broken up into 10 departments. And each one of those departments is run by a director. Residents will have access to each one of those directors.
Nice. So Tashanna, thank you, Mayor. So Tashanna, you went in person to the meeting. I actually watched virtually and saw how the meeting ran. I was curious to see how it would go. And there were quite a few people that were there from my understanding. They had a nice crowd that was there, which is awesome. But from your perspective, if you could just say to us your takeaways from it, how you felt about it, tell the mayor, tell me, tell everybody, your takeaways from it, the good, what could be improved, if anything, your thoughts on it.
Yeah, so I loved it. I just have to be honest. I love what it felt, where I believe it's going. I believe that it's a beautiful effort. I felt like people had the opportunity to be seen, to be heard. It was that without judgment. No one was saying, be quiet. That's not that. It was like, go ahead and say it. Say it raw, say it Trenton, say it however. And I thought that was a beautiful moment, right? Because people were able to just really, express those things that have been on their heart. So I think it was beautiful. The only thing I would say was the time. And I know, but that's being explored, maybe a 5 o'clock time. It's going to be a 5 o'clock time for June. My opinion, maybe like 6, just because we want to give people a chance to get out from work and find childcare. So I think with community engagement, it has to be intentional. And that may be a later time outside of 5 o'clock, because I believe people want to be heard. I believe they want to, to have that moment in that space, and this is that moment. I think it's a beautiful moment. It was beautiful, and I think the effort is beautiful.
Yeah, I think the participants, they were real and they brought in real concerns of theirs, and uh, they felt that they got listened to. And the problems are actually being worked on now. And we have directors talking about those instances, particularly when it comes to public safety or economic development. And it's a good way to engage with your government.
Yeah.
So, Tashanna, let me ask you this question. So, your area of expertise is mental health, is it not?
Yes, ma'am.
Okay, so when you look at the city and everything that's happening in it and the efforts that could be made towards mental health, or because the mayor said about, public safety and things like that, talk to us about your feelings about what the city can do, has done, is not doing, needs to do when it comes to addressing mental health needs in the city.
So in my opinion, I think there needs to be a stronger system for the coordination of care. For me, a lot of the organizations are divided, right? I think there has to be a system where there's a better oversight of what is being done when it comes to mental health, housing, and all of the things, right, that give people in Trenton a quality of life. Right. So we have some organizations don't answer the phone. They don't respond to referrals. They don't contact people back. They are always oftentimes out of money. Right. When we look at certain organizations that deal with housing and people are facing eviction, they're being denied. I'm getting calls all the time where people are being denied. Right. So for me, a more streamlined strategy in place to build a more effective system of coordination of care across agencies, especially for vulnerable populations like Trenton and the unhoused, those with mental health needs, and returning citizens. It shouldn't be all over the place. No. So I would love to just see it just better coordinated, a really, really united, where everybody has everybody's number, where everybody's holding each other accountable, where an agency can say, hey, I might not have funding for this yet, but I understand that you guys do have that over there. Can I streamline these individuals over here? Okay, you may have funds for housing, we may not. How can we interlink? How can we combine our services? Like just having those real conversations across agencies, because people are on waiting lists when it comes to mental health. We have some agencies that people are waiting for a year to be seen. We have a lot of the agencies do not accept Medicaid. A lot of people in Trenton are on Medicaid. So they have to try to get help and support out of their pocket. They can't afford it. And they had to choose a session and food, they're going to choose food. So they are having to make decisions about their life and their stability and their basic need. So for me, just really us having a solidified plan to figure out how do we coordinate this to make sure people are really getting their needs met in real time.
And you'll find mental health should be elevated the same as physical health, and they don't. And mental health, in many instances, is much more important because it's the basis of educational learning, whether you'll be involved in criminal activities, whether you'll become homeless, how to deal with challenges. And the more mental health challenges the individual has, the worse it gets to them, and their problems seem to compile strictly because of those mental health issues.
Yeah.
I don't think that we can do enough to provide such programs so that that we could deal with real issues that are affecting people out there in our community.
Yeah, and I do want to mention this, right? We have in human services and social work, we have a framework we call Maslow hierarchy of needs. I know, Crystal, you might know that. Is a level model of human development, right? And it has different phases. And the first phase is the basic needs, being survival needs, including food, housing, water, shelter, rest. The second one is in personal and financial security, health, employment, and protection from harm. I won't go over level 3, 4, 5. But level 3, 4, 5, loving and belonging. 4, emotional esteem needs, and level 5, self-actualization. So according to this theory, a person can't even go to the other levels if their basic need is not met. So they can't even think about mental health if their basic need as far as food, safety, and housing is not met. Many of the residents of Trenton are stuck on level 1. They're still struggling to meet their basic needs. They don't have the jobs that allow them to pay their rent. Without income, they can't feed themselves, or they can't care for their children. And when survival is their only priority, there's no room for healing, no time for community care. They're not thinking about the garbage on the, like they can't eat. And no, they have no energy left to keep a neighborhood clean, to engage. And that's when the violence increases and neighborhoods decline. Not because people don't care, they're exhausted just trying to survive. So we can talk about the mental health crisis and how we can really explore the mental health when we focus on the basic needs of Trentonians. They're hungry, they're homeless, and they need those real resources in real time.
Mm-hmm.
And that's one of the things Dr. Diego Minicapelli, our health director, is painfully aware of, that there is such a need for mental health services. One of the things that we're now doing at the police is a program called Arrive Together, so that it's not just a complete police response, but with mental health counselors, particularly when there's a homelessness issue or domestic violence even, mental health counselors can arrive with the police and try to diffuse the situation from it escalating or getting worse. Many cops don't have the ability to know about mental health issues and just deal with things, strictly by the book, whether there's a perceived violation of the law. But if they take into account a person's mental stability, a different reaction should happen.
I'm taking notes. I think that this should be a part of the police training, though. I think, and we've spoken to Director Wilson about that as well, that the police officers, as a part of their training, and I'm not sure if it actually is or is not yet, but as a part of their training in the academy and all that stuff, when they come in, the mental health piece, at least they need to touch on it so that they're aware, you know what I mean? It exists, and then how to deal with people, then have people come in and actually talk to them about, this is how you de-escalate. Yeah, we'll be there, but what happens in the meantime that we're trying to get there and you are there, right? They should be prepared that they can at least kind of maneuver and manage without, things escalating to something else.
Yeah.
In the meantime.
It is dealt with in the academy, but it's one of those, I was absent that day. They gloss over it, and it is offered, but it's that continual training that needs to happen. And that's one of the things that we're concentrating, especially after the DOJ investigation, that this needs to be reinforced during roll call. Hey, you're going to come invariably to a mental health crisis. You have to de-escalate the moment and not make it worse by just saying, hey, he violated the statute. That's it. So it's really important that the training continues, not just the one time during police academy or the one class, but that this is something that's continual to be trained with police officers.
Yeah, and I want to say something to that. It goes back to my point that we also must, again, hold those systems accountable, right? Because, for example, 2 weeks ago, I had a mental health call crisis, right? A mom called me. Her daughter was literally about to jump out the window. When I pulled up, the baby was out the window. The cops didn't come till 2 hours later. I called an organization. They said, oh, just get her here. Sir, she's out the window. What do you mean? The mom just has to bring her here. I called another organization and they said, well, our folks are not trained for that. What do you mean? So if I wasn't who I was, right, I wouldn't have had the ability to know how to talk that baby down out the window. I had to talk her down, get her in my car, take her for a drive, give her, got her some dinner, came back to do a family session. I was out until 1 o'clock in the morning. I was leaving by the time the cops came. So I love the program, but we have to make sure that it's working, that it's effective, and people are being accountable. Because when a crisis is happening, you don't get to just pick up the phone and hang up. So I think that we have to, stay on that type of stuff to make sure that people are really doing their part, because people's needs are not being really met.
So to that point, Mayor, so now, like when Tosh was talking about, the child out the window, right? And what do we do? I mean, is it far-fetched to say that we could even call the fire department? Because I mean, like, they have the ladders and the fire trucks and stuff. Like, for me,
Yep.
I would think if the cop wasn't around, I would call the fire department to be like, well, y'all come and bring a ladder. It's a child hanging out the window. Somebody has to get the child from out the window.
Yeah, something like that really needs to be analyzed in hindsight, so
Yeah.
that it prevents those issues in the future. To find out what floor they're on, whether it's an apartment building, whether it's in a house. But yeah, I think that the police need to have a better humane response. And that's one of those that the dispatchers should also be trained, so that they
That's
know
right.
how to interact with the caller, because maybe they can say, well, yeah, we probably need the fire department as well.
Right,
Mhm.
right.
Mhm.
And Mayor and Councilwoman, that's what I was saying when I say a better coordination of care. We should all be aligned. Every system should have the same talk, the same verbiage, the same feeling, the same training, right? So it's a special word. Like, okay, this is mental health. What level of mental health? What does that mean? That means that's the fire department. That's maybe a trained therapist. Maybe that's a peer therapist. That's somebody from the street team. All of these people are set as a unit to go out to emergency calls. And then we have to follow up. We just cannot attend to emergencies and there's no follow-up, right? That means, are we putting this person in therapy? Are we saying, is this a diagnosis? How do we make sure that this is prevented? So with that being said, that means the follow-up agency has to do their part, because guess what? If they don't, somebody will be out the window in 2 more weeks, right?
Yeah.
We have to make sure we're managing people's medicine. We don't get to not have a psychiatric appointment when somebody is on medicine and you don't see them in 2 months, or a therapist leave and you don't inform the person. So now they're on the street and now they're downtown because they've been off their medication for 3 months and nobody had followed up. So that's the coordination of care.
When somebody's having a mental health crisis like that, it really would be important to follow up, to make sure they're in counseling, because you just don't want the police to close the door and say, okay, that chapter is over.
Right.
How do you prevent the next instance? By saying, are you referred to mental health? And with good training, the police would have that information at their disposal, especially doing the arrive together, because then mental health counselors can take over. And likewise, we have wonderful police chaplains that it would be interesting to dispatch them as well.
Yes.
Because maybe there could be a spiritual angle to diffuse the situation. Oftentimes when there's a murder, we dispatch this police chaplains to the house, because invariably the families do want to talk about some spiritual healing for the family, and also to better talk about the deceased person.
I love that.
I like what you said, Tosh, about the word, like the set up the system of the word to know who to come out, who to dispatch, and when, and not only for the police to be trained, but the dispatchers and stuff as well, when they're getting calls and stuff like that. I think that that's important. I know that about a year or so ago, the administration, Assemblyman Varelli, Commissioner Melker, and I, with the mayor's blessing, and he had put former Director Richardson with us on the mental health movement that we were moving around, showing the documentary of I've Been Shot, right? You were there, Tosh, you were a part of it with us. But in that, when we talked about it, I had actually asked for a mental health mobile that could be equipped with reference materials and things like that. And then maybe we had somebody who could talk to people that would kind of move through the neighborhoods. And I know that they were looking into that. I had spoken to now B.A. Richardson about that mental health mobile again, and I know that they're looking into it to see if there are grant funds available now at this time that we can actualize that. Mayor, I think that would be really cool to get behind and move, because then at least we're taking it to the people, right, Tasha? As you're saying, taking it to the people. So you have a choice whether you want to get on or not. But guess what? Here's a van that has, and it doesn't mean like mental health to say like you got to get on and get therapeutic treatment. It's here's documentation of paperwork for social services. Here's this for this organization. You need food. Here's this. You need, rent help. Here's this. And we're actually taking it and moving it around, because unfortunately, the one thing we find is that no matter how much the mayor tries to get the word out around town about things, everybody's not catching the same messages. So we have to be even more creative on how we get things out to the people, right? Not everybody's on GovPilot. Not everybody reads the mail. Not everybody looks on Facebook or the website. Not everybody, right? So how do we do it? Sometimes you got to move through the streets. And I think we need to do that.
Yeah, and I actually had coincidentally a meeting with Dr. Minicapelli, and he's actually trying to secure a health mobile unit that could do all of the above, do vaccines, do blood testing, do lead testing, and mental health screening. So stay tuned. And then like anything in government, it's a matter of securing the money to get the job done.
Yeah.
But I think I do want to say something to that.
Go ahead.
I think that has to be a priority, because I think that's a beautiful idea. Because if the mobile and the van is coming to people, that's how you reduce. That's how we decrease, right? You decrease homelessness when they have the resources right there, right? You decrease, you increase home ownership when you have somebody that's aware of or an expert of home ownership who's coming to the street and giving the people the resources and saying, hey, the seminar is coming here, come here for this information. And I think the mental health, it should be different from the physical. I would say that, but I won't stay there that long. We can talk off that. But I also think this is why Voice of the People is so important, because these are community residents who would love to be the voice.
So tell us, wait, real quick, Tosh. So real quick, you have to tell us about us, and I want you to tell us first, but then I want to get to some of these comments on Facebook. But go ahead and tell the mayor so he gets it. And I get it, and everybody watching gets it. I was with you on Saturday, right? And I've been watching and knowing. But I want you to tell everybody that's watching who are Voices of the People. What is this?
Yeah, so Voices of the People. This is my shirt. No more decisions about us without us. Hear us out. We are community residents. Community residents who with lived experience, who live here, who have suffered here, who have survived here, and want to be a part of the conversation. We stand as a bridge between the stakeholders, politicians, and the community. So we are the safe space where people can come to share their concerns, say what they need, and then we can get that information back out to you all. For example, this is a beautiful moment. Someone who is a community resident, community advocate, who's been here, who lives here, that says, hey, this is what we're seeing on the ground. How do we get this information to you? How do we talk about what we need? How do we say, let's create this type of programming? Let's even bring some grant ideas to you all. Let's say this is the need based on what we who still live here say is the need. Right? So we're just a group of people that's saying we're trained. We're going to become certified one day when we figure that certification part out. Right now, we're trained on how to advocate, how to talk to our stakeholders, how to engage respectfully. But we are saying, hey, we are filling the gap. We want to be heard. Put us at the table. We have some ideas. We have some data. We have some research. We have some lived experience. And then we have a website where people can get that information. And we're committed to making sure that we unite with you all and not be divided.
Okay. Voices of the People. I like it. So to that end, and thank you, Tosh, for that. And for your advocacy and for your sincerity in your advocacy. Mayor, she's the real deal. She's the real deal. I've been watching her and dealing with her for a long time. This young lady has the heart of the people, and the very best of intentions to help bridge the gap and move things forward. So Pastor Cushman says, "Hey, Eric Cushman, I love Revy Rev. He was up in Newark. He was up there locking arms with the interfaith leaders doing his thing, my man." So he said here, given the recent ICE issues in Newark, operating an illegal facility known as Delaney Hall, is the city prepared when the same thing is going to happen at Bo Robinson?
Yeah, we're not thrilled of occupying Bo Robinson, and so we are going to have to be prepared. I think the whole thing, the reason why they went to Newark is I think ICE so far has turned down Bo Robinson, but you never know with the Trump administration. They do one thing one day and then do the other the next day. But it is really concerning. And luckily, so far, we've been spared. ICE has been in a number of times, but they haven't caused the disruption that they have in other municipalities.
Okay. And then Chalita Singh Chohones, Chuleta Sin Koja. You know who you are. I'm sorry. She said, we need to do something with rent control because these landlords are out of pocket, almost $6,000 to move into roach and rat motels, and control something with them to take you to court for eviction as in an amount because you owe $200. Then they take you to court and it ruins your record for a long time. She also feels that court papers should be translated. It will help a lot of Spanish-speaking people who don't even understand what they are receiving. And the barrier has left a lot of homeless because they don't understand. And why is it that if you don't have children under 12, why can't you get any assistance for housing or anything?
That is a tall order, but one, if you are in an apartment that you feel that has rodents in it or leaky pipes or leaky ceiling, please call the inspections department at City Hall because we will send in inspectors. We do have a rent stabilization board. Stephanie Register is in charge of that. You can come into City Hall and talk to Stephanie about filing a complaint about your landlord. We don't have absolute rent control, but we do have laws that allow only a certain percentage of increase in rent per year. And that's what the Rent Stabilization Board does, is hold hearings on exorbitant rent that is happening. So we want to know about that, but we particularly want to know about the quality of life living in an apartment. They could lose their license to rent in the future, and so we do want to know about that in our inspections department.
All right. And then she the one, Judah, she the one said, good evening. All right, let's see. Vanity Vickers. Hey, Vanity. She said, and it's sad going through it right now with her little brother, right? We had to send him to crisis last night. They kept him there for 2 hours and then let him go because he was not suicidal, but he attacked her mother multiple times. And that's the answer that she's been getting, right? So you get these people in and then they're sending these people out. We have to do better. I mean, that's not on the city, that's on whatever treatment place that they went to. But if we're funding some of these people, or if they're part of our continuum of care for certain services that people should be giving, then yeah, I agree. We do need to look a little bit closer and see what exactly is going on. Chuleta says the Hub program is a great program. Yes, the Trenton Transformation Hub for Healing, Unity, and Belonging. They're at 16 West Front Street on the 3rd floor. Dr. Thomas is there. Wonderful people there. One second, there was some more stuff. Give me a second. Tyler Fowler says, talking about effective mental health training for police is in constant conversation, but is not often actualized. And so, and to that point, it does need to be actualized, right? Because we are in a time where mental health is serious. Just the other day, when we were downtown, at your video shoot, Tosh. When I was leaving, the guy
Mhm.
was there and he was like swaying all over the place. He had this dog dragging the dog. I actually went to the police officer that I saw and said, I need you to go over there and I need you to assess the situation and see what's going on. Now,
Oh,
I did not wait to see what happened when they went over there. But if they went over there, had a conversation, and based on whatever training or whatever was going on, I don't know if they went and called somebody else to see what was happening. Somebody else put a video up of somebody like passed out on the street, like laid out. How is it that now we have people just laid out in the middle of the street? And they're just laying there. So we have to do better when it comes to taking these things serious because it's going to be widespread and it is not acceptable. It's never been acceptable. But we have to do better and think smarter. And I think that partnering and working with people that actually bring solutions to the table or ideas, right? We
Mhm.
have a lot of people that will come and complain, but Tosh comes and brings solutions, right, Mayor? That
yes, absolutely.
we want solution-based people. Go ahead,
And
Mayor.
then
And
I do
Tyler,
want to say,
oh, I'm
no,
sorry.
no, go ahead, Mary. Nope, you go.
And Tyler, that's a great question. And also about training. That was one of
Mhm.
the things that was in the DOJ, Department of Justice report that Trenton is now implementing. So we are finally coming to the point where we have to plan for better training. We're also accrediting the police department, which is unique among police departments where evaluators come in, and
Mhm.
that's one of the requirements to make sure that they have the proper training. So all of that is being implemented, and we hope we can do better in the future. But the other thing, if you see something, please say something. A lot of people say, I'm not calling the police because they're not going to respond. Please don't think that way. Call anyway because your complaint is recorded so that there is a recording of that. And shame on us if we find out later that there was a call about a person laying in the street and it wasn't responded to. So that's really important because I often will hear a complaint such as that. I'll follow up with the police director. He'll go back to the CAD reports, the dispatcher reports, and find out no one called. So it is important for the citizens to take part in as well. Just don't think that the police are going to actually see that. You know, there's a lot of miles on the roads and they often overlook a street. So that could happen unless it's brought to the attention of the police. So if you see somebody laying in the street, please call the police. And especially now that we have mental health counselors called Arrive Together, that that hopefully will be less of an issue in the future.
Yeah. So, Crystal, I actually was still there when the cops came, and
Okay.
I looked at everything. And what I would have loved to see is that they would have given the young man resources. I think they just had a conversation and they kind of just like left. And I was like, oh, okay. What does that solve? That doesn't solve the issue. This might be a substance use issue. All right.
Right.
So who is the substance use organization? Okay, rescue mission has a mobile unit. Okay, let me call the rescue mission so the mobile unit can come down here specifically because they do an amazing job, the mobile unit. And maybe let's engage them because again, these organizations get funding to do the work. We have to make sure they're doing the work because it would have been a beautiful moment, right? For him to say, hey, thank you for the call. Let me call this person. This is that safe word. Hey, we come out as a team. We go and love him. He might be hungry. What is the need right now? Not just the need of he's laying right here and this is a behavior. This is a symptom. There's a root cause. And if we are not addressing the root cause, we will continue to only band-aid. That whole system downtown, there's root causes to that addiction, right? There's some trauma that has never been identified. There's some trauma that's never been assessed. And everybody's not going to walk into an office. They do not, sometimes trauma have the cognitive ability to be able to communicate what they need. As professionals and expertise, we know what they need. Go to them. I believe mental health people should be walking the streets of downtown. You don't have to give somebody Suboxone right there. Have a conversation. And then you
Okay.
build relationships, and then pow, you walk them to the mental health agency. And now you give them love and joy, and they want to help themselves. So that's again what we're talking about, that coordinated care. If we do not have that oversight, we will continue with this cycle.
Okay. Thank you. Recon Heat said Handle with Care is an excellent program
Okay.
that works with people. So that's in here.
Okay. Right there.
Follow up with that, Handle with Care. Also, Pastor Cushman said Patterson street teams are trained in crisis intervention. I know that our street team dealt with the Newark street teams, but maybe we need to look at Patterson as well, and have conversations to see if something is done differently. Jada Robbins said police definitely need to be trained in all units, meaning police, paramedics, fire, mental health services need to be all on the call. An appropriate group responds immediately. That was to Tasha's point of what she was saying. And this is all good stuff, right? See, the thing is, we're open and receptive to hear solutions, because I'm just not speaking for you, Mayor, but I'm gonna speak for me and for us. While we know what we know, we don't know everything. And that's just what it is. And this is a community effort for us to try to make this right, and try to reach out and then to hear. And so some may say, well, you're doing this now, you're doing this. Yeah, we've tried. We have city council meetings for people to come. Sometimes they come, they don't. The council people go out and have individual meetings throughout the community. Sometimes people come, sometimes they don't. Now they're doing the city stat meetings, right? Hopefully more people will come, and then hopefully more and more people will come to the various meetings. So this way, everybody's touching somebody in some capacity, that we can all reach everybody with the same message. That is the hope.
Absolutely.
Amen.
Stephanie Reed asks, is the city prepared for a viable solution to resolve the water crisis with Trenton Waterworks?
Absolutely. And we had a community meeting the other night with DEP. Trenton is moving forward, and we are making improvements. We're working with DEP. They're helping us. We're doing, right now, the water is safe to drink, and that is tested daily and hourly. And of course, there are times when when there's a storm or something else that happens, and the water is imbalanced. But by primarily 90+% of the time, your water is safe to drink. We are making substantial investments in the filtration plant, which is the first stop after it's taken from the Delaware. We're discontinuing use of the reservoir with storage tanks, so that it will be a lot safer throughout the system, where we've already replaced 1/3 of the galvanized leaded pipes that are in the system, and we do have 2/3 to go, but we're working with homeowners. But we are committed to be good stewards of the water system. And I know the reputation is somewhat marred because, we did substantial uninvestment over years. We're trying to make up and work with DEP, and in partnership with them, we're delivering a product that we think is safe. It's cheaper than private water systems, and we're up to clean water standards.
And then Cheryl Littlejohn says, what is happening with the many police stations that are not in use?
Well, they are actually in use. There's two of them. One is the one that's in the East Ward on Greenwood. That's used not only for community meetings, but also as a internal affairs unit. We wanted the internal affairs unit to be not part of the police station. We wanted its own separate unit that was independent from operating from the police department, and that's where they reside on Greenwood Avenue. The one in the West Ward is also equally used by community groups, but it's also used by the police, particularly the vantage point of patrolling. But both mini police stations are being utilized.
Okay. And then Shamel Lee said, what are your thoughts about commercial trash dumpsters for buildings with 4 units or more?
We cannot, first of all, they have to follow the ordinance. So I think we'd have to look in to see what the requirement is right now. That's something that council could take up. But we, from time to time, get complaints that a lot of landlords don't put the appropriate dumpster behind their buildings. And we have to be vigilant and make sure that they're having them that has the capacity to hold the garbage from those apartment units.
Okay. Vanity Vicker says, we need a hospital. Yes, we do. That allows women delivery in Mercer County instead of having to drive 30 minutes or more, which is dangerous, right? I agree.
I don't think anybody disagrees with it. There was a time where Mercer Hospital on Bellevue was the maternity ward for the whole area. But as the whole healthcare dynamics has changed, people go to urgent cares. There's 2 other hospitals, Princeton and now Hopewell and the one in Hamilton. So they compete with each other. And even the one in Hamilton does not do maternal care because it's so expensive. So it has to fit their business model. Nonetheless, the First Lady is doing a maternal center on Pennington Avenue. We hope that that's coming out. And from there, we hope to spring actual facilities that will deliver locally, but and certainly to do prenatal care and postnatal care. But we get it. But that's something a business model from a hospital has to take up.
Right. So shout out to First Lady Rosalie Boyer of Greater Mount Zion. That's the First Lady that the mayor is talking about. Edna Roman said, going out and offering real assistance, right? A van that will also drive them to a program. So that's interesting, right? When we talk about that mental health mobile. So if they're out moving around and giving out assistance, if somebody needs to go to a program, right? That could be something that could possibly be looked into as well with the people.
Or we can partner. I think a good partnership would be with Go Trenton with that. You know, it could be a nice smooth handoff. If the mobile can't take them, have the Go Trenton pull up and hey,
let's go.
Also, that's the beauty of the wellness center, right? They can, if they get a ride, if we can get them to the wellness center could get them to their appointments. So there it goes again, the coordination of care, all of it. If it's one big system, will work itself out. Mobile unit to this, to this, to this. I have it all planned out and I have it all written down. I'll express that with you two separately, but I have the vision. I can see if all of, and because I do the work, I make the phone calls. I'm here in real time. I see how when everything connects, when it comes to job stability, mental health, housing, when a person feels sustained, how they're less violent, how their behavior change, how their attitude change, how they engage others and how they engage themselves. So I love that. That was a good thought about that transportation piece.
So you touched on something else. You said the wellness center. So if you could just tell everybody what the wellness center is and where the wellness center is and briefly what it is that the wellness center does so that people know that the services are provided there.
Yes, I will start by saying this wellness center is full of free services. Everything is free. Everything that is done. We do not bill your insurance. We are not asking for your insurance information. We want you to come and be whole. We want you to have a safe space. The Wellness Center focuses on giving people and resources. Again, free resources, connecting them. We have women groups, men's groups, arts and crafts, game nights, life skill workshops, financial literacy session, resource fairs, therapeutic support, trips, physical fitness sessions, GED preparation and tutor, job readiness programs, mental health support groups, peer-to-peer support, yoga, line dancing, outdoor recreation, trips to local theaters. We connect with all of the folks.
I need to be there at the Wellness Center. Mayor, we need to go there.
It is right here at the Rescue Mission of Trenton. It is a new initiative that they started. It's been open for a month, and we have seen over 100 people in a month because we are out there on the grounds doing the work.
Excellent. Thank you. Jada Robbins says, this live stream is awesome. I'm at work right now and I'm able to have a say. These should be more frequent.
Oh.
I know, look, I know. Jada, look, we're working on it, but you know, the mayor is a busy guy and I'm a busy girl. But we make time to come together to try to do this. We said we would do it once a month. You know, and we was pretty much sticking to that based on our schedules and everything. But
and we love the format of guests, particularly Dr. Ellis. This is such an important topic that we really appreciate you taking the time to join us, because there's a lot of people that don't want to listen to Crystal and Reed. They want to hear people that really know what they're talking about. And it's really apparent that Dr. Ellis does have a plan and she's on a mission.
That's right. Benedict Joseph said, glad this is live and allowing citizens to post their questions, feedback, and frustration with issues. Yeah, that's what we're all about. You know what I mean? If it gets a little left and out of pocket, I'm going to bring it right where it needs to be. But, you know, we're always open to have the conversations with the people because that's what this is all about. And shout out to Thomas Peterson, the man with the plan that makes the platform happen, the owner, founder of Peterson's Breaking News of Trenton, for giving us this time for us to do that. Benedict Joseph said, yes, once a month is great. Miss Chuletta said, is the place walk-in, is the Wellness Center walk-in?
Yes. It is open from 11 a.m. to 7 p.m. every Monday through Saturday. And guess what? We partner with Go Trenton. So guess what? We can get you here and we can get you home.
Oh.
There we go. I love Go Trenton.
Dr. Tasha's doing the work, y'all. I'm making the connections. I'm trying to do what I do with BOP and the Wellness Center. It is an honor to serve here. I live here. I serve here. I love the people here. I still eat here. I still shop here. So I want to make sure that I'm healthy. I have a daughter here, and I want to make sure she has the resources. My family is still here. My mom works here. So I want to make sure they are happy here.
All right. So listen, before we close out, well, I'll go, Dr. Ellis, anything you want to say in closing briefly for us, then I'll yield to you, Mayor, for you to close us out before we go. Closing remarks.
I want to say thank you first, Mayor. Thank you, Crystal, Councilwoman Crystal. Let's get that clear.
It's all right. It's all right. And I didn't make her say it. Wait a minute. And I didn't say that you had to say it because I'm always Crystal. I just happen to be the councilwoman, right?
Yes,
so
but
thank you for the love. I appreciate it.
You have to give honor where it is due. And I believe in getting honor and especially to people who are doing the real work. And I know you in real time. This is not fake. This is not a facade. I have been in distress with people in the community. I'm like, Councilwoman, you like, hold on, one call. And guess what? It's been 2 seconds. So you have my love because it's real and it's true. So I just want to say something to Trenton. I want to say that I believe that they want to hear us. You have to talk. You have to speak. You can no longer be in doubt or in fear or let the mindset that nobody wants to hear you make you silent. If you are not safe to speak, please, please, please always contact me, contact someone from the coalition. We want to hear those concerns, and we trust our mayor, we trust our council person. We'll get those concerns to them, but we can no longer be silent. If we want to say that no more choices will be made without us, about us, you have to talk. You have to support. You have to show up. You have to sign up. No one is coming to save you. You have to come and save yourself. So put your cape on. Come out to these meetings. Come into the conversations.
Yeah.
Draw up your plans. And trust me, you will be heard because guess what? I'm fighting for you. We are fighting for you. So I love you all, Trenton. And that is my last word.
So somebody asked, wait a minute, Chuletta said, how can they contact you directly, Tasha?
Oh.
Yes, I am always at the Wellness Center because I want you all here. But my phone
what's the phone number at the Wellness Center?
Yeah, so this is my cell at the Wellness Center. It is 609-960-6007. Or please visit www.bopcoalition.com. You can, if you have service needs, you can go on the website. You can tell us what you need. We have a turnaround time that we'll call you within the first 20 minutes of your insight, of your request. We have helped over 100 people within 2 weeks. So it's a lot of work, but we want to make sure that you are heard and we're getting that information, your concerns out to the right people. So, yep, that's my number.
All right. Thank you. Mayor, before you talk, Paul Quinn said, where is the Affordable Housing Act?
The Affordable Housing Act is all over the city. I
Right.
know it's not enough, but when the state's coalition on affordable housing came up with a formula, they actually looked at Trenton's numbers, and we don't have an obligation. We know we have a moral obligation, but we don't have a legal obligation like the suburbs do, and they are mandated in providing affordable housing. But we are constantly having those discussions. The Housing Authority itself is doing an expansion program in the North Ward, and we continue to look for housing options for all our residents.
Nice. Thank you. All right. And then, Mayor, closing remarks from you for everyone watching. They're really.
I want to thank you two ladies for putting yourselves out there. Councilwoman, you do a great job making sure that the city is informed and entertained at the same time.
That's it. Thank you.
And Dr. Ellis.
Her dances are amazing.
And Dr. Ellis, I can't thank you enough for bringing such an important subject, because we all, if anybody said who has mental health issues in their family, everybody raises their hand. Right. So we all are there, but we have to be there for each other, and we have to do what we can as a city to make sure that those people who do not have family members or a cushion to fall back on, that we could step up to the plate and provide those options for our residents.
Awesome. So thank you. Thank you, Mayor. Listen, I just want to take a moment to shout out the administration, right? I'm going to shout them out. I put in Linda Romero had reached out to me about the driveway going into Architect Housing on East Front Street. She reached out. It was a total disaster. I reached out to the administration. They kept their word. They're out there today actually working on fixing it. I went by and took pictures right when it was tore up. I rolled by today. I saw that they're working on it. And it's things like that, right? When we talk about quality of life. So, Mayor, thank you for reinforcing with your team that, you know what, it is Trenton first. It was always Trenton first. Now that the council is up and moving and we're all rolling in time with each other and projects are being put forth, now you can actually ride through the streets and you can see Andre Williams out there on Chestnut redoing these houses and stuff. You can start seeing the revitalization of Trenton. We're seeing the residents coming in now that we've declared the city a rehabilitation zone, that they're buying properties now, that they are able to own their own space here in the city. And that's what it's all about. That we see now that Public Works came out when Ivy Avery had me out there several times at West State, right, in Prospect, about them signs for the crossing guard, because we need help out there. What can we do? And Wally and Hector came out and looked and took an assessment and got signs that are out there now for the safety of the children. That is what it's all about. It's about the houses being demolished on Bootnott Street that myself and Councilwoman Frisbee had advocated for on behalf of Ms. Coleman and the people there that are watching, and now they're being torn down. That Jennifer Williams, right, Councilwoman Williams, and her trees that are all over the place that she wants taken down, that Parks and Recreation are taking them down, that Jenna Figueroa Kattenberg, our South Ward Councilwoman, has been advocating even through her pregnancy to get South Trenton taken care of, and from all the street repairs and the tree repairs and demolitions and everything that has been taking place, right? She rocking and she rolling. Joe Harrison out in the East doing his thing out there, helping the constituents, showing up on Euclid Avenue to the meetings, showing at the Briggs Library, helping his constituents when they have complaints about noise complaints or trees or whatever. He's out there actually cutting down bushes and digging up stuff. Now, I'm not doing all that. But I'll report it for you. But he's hands on and he's doing it, right? Councilwoman Edwards, she's out there doing her thing. Council President Gonzalez is out there meeting and greeting the people right where they are, having important meetings about immigration, having important meetings about quality of life issues for the people, and working to make sure that Trenton is a better place. And so I'm thankful to all of my council colleagues. I believe I have mentioned them all. I am grateful to all the council colleagues for the work that they do. Yes. And I'm thankful to the mayor and the administration for the work that you're doing and for standing firm. People may say you're not moving fast enough. People might say you ain't moving at all. You have been held back for a long time from things, and now we're starting to get in the flow, and we're starting to move, and now we're starting to see the fruits of the labor that are happening. And so for that, I'm grateful. Trenton, I love you. I thank everybody for watching us here on Chopping It Up with us. We coming back again. We're going to do it. We're going to have another community guest come on and talk with us authentically. Dr. Ellis, we thank you and we appreciate you for your time, for your intellect, for your love for the city. We thank you for Voices of the People. No more decisions about us without us. I think that is wonderful, and we look forward to seeing and hearing more. I would suggest, though, that you get the mayor. He needs a shirt, right? And I need a bigger shirt. I got my shirt. Maybe, I don't know. I might be able to trade with him, but we need our shirts, right? We need our shirts so that we can rep the set when we out and about as well. The mayor loves shirts, and he loves stuff like that, and he loves the people. So do I. So on that, with all that being said, y'all, it's me, Crystal Feliciano. We're here. Peterson's Breaking News of Trenton, Chopping It Up. Thank you to Thomas Peterson, the man with the plan that makes the platform happen. Until we meet again the next time, y'all, we out. Good night, Mayor. Good night, Dr. Ellis, and thank you.
Thank you.
God bless.
All right. God bless.